Hello, this is Dr. Salem, Doctor of Physical Therapy from Brooklyn, New York. Welcome to my clinic. Welcome to our YouTube channel. Coming now, see the cover of my 5 DVD set that I published. It has more than 65 educational videos that will help resolve your pain and dysfunction by simple, effective manual therapy techniques that is proven to get results immediately. You can order through sending a text or calling 718-2000-108. 718-2000-108. Therapy from Brooklyn, New York. Google Dr. Salem Physical Therapy. You're going to find a lot about us. You're going to see what our clients say. We're proud of what our clients leave as a review. Now, one of my clients told me that one of her friends, she cannot come to see me. She lives far and she has some neck problems and she requested some neck exercises. Now I'm going to show you some of the neck exercises, which are very safe to do. Use because you're not consuming the joints. You're only building muscle tension that strengthen your muscles, but the joints are not being consumed at all. So it's better to use it in I consume the joints or over consume the joints or worn the joints. If you're aware you're going to damage anything, you want to damage ligament, if you're waiting for a ligament to heal, if you're waiting for a muscle or soft tissue to heal, so it's better to do static neck exercises because that way you if you're not using the muscles, it's going to get wasted or get atrophied or get weak. So you're going to do static neck exercises to prevent muscle weakness. Not only that, but even get muscles stronger. This is the forward head push. You're pushing your head forward. Again, is the hand, and the hand is pushing backward. This to strengthen your, anterior or your front neck muscles, as you see now. Pushing backward with the hand, pushing with the head. The forces should be exactly equal. The hand will adjust the push or the force based on the amount of pressure the head can exert or the neck muscles can exert. Equal forces. So because if the muscles are not equal, it can reduce movement. Be sure that you can test your muscles with the other hand. One hand right now give resistance, the other hand check your muscles are working. Be sure the sternum is up. Check your chin backward. Keep your shoulder straight. Retract your scapulae. Keep your belly tucked in. This is going to do the posterior neck exercises, the back neck muscles. The way you do it now here, I'm going to put my hands just I would say caudal or just below the occipital condyles. And when I do now, I'm going to push with the head backward. And again, it's my hands. The hands are pushing anteriorly, pushing forward. Not only forward, I suggest you do, which I like it, you push forward and a little bit up. You do anterior pressure on your head and push also cephalic. Why? Because it gives you a little bit traction, giving your head a little bit traction. Usually the traction of the head is helpful to increase the space between the occiput and C2, because we're going to consider that occiput C0 and C1 has no spinous process. C2 is the first vertebra has a spinous process, as I'm going to show you later now. So now I'm doing here, pushing with my hand forward and at the same time pushing forward and up cephalic, pushing cephalic, giving yourself a little traction, pull your neck up a little bit. This is get the best of the exercise to push forward anteriorly and give yourself a little bit traction as well. This is very beneficial to improve the space between the occipital and C2, give more room, give more space for C1, which is one of the most abnormalities I see in my clinic with my patients. Most of the people, I would say around 75%, have narrowing between occipital and C2, which is really need to be addressed and corrected. Now I'm going to do the side neck muscles. I'm going to strengthen the right side now, pushing with the head, pushing with the head to the right, pushing with the hand to the left. And we can check with the left hand now. My right hand give resistance, left hand checking the muscles. I'll be sure they're working right, and be sure the muscles are building retention. Do the other side, left side. Now my left hand is giving resistance to the head. Equal forces, as we said. You can check the muscles with the right hand if you need to be sure it's working. Again, right, left. Keep practicing this to create muscle balance. You need to keep the same counts. If you go like 10 on the right, do 10 on the left. Unless you have a weaker side and you want to make it stronger, you can increase the duration accordingly. But if you have the muscles are balanced and equal, and I think you need only the professionals or like a doctor or a therapist to tell you now again, if the muscle imbalance. That's why it's better to get the professional care, because the doctors or professional can find out if the muscles are weaker, so you're gonna work more on the weaker side to balance it with the stronger side. One of the causes of the neck pain is the muscle imbalance. If one side is stronger than other, one group of muscles are more stronger. Now again, to strengthen the front, strengthen the back. When you strengthen the back, be sure to give, as I said, we're going to give you forward pressure with the hands on the head, at the same time give it out cephalic, anterior and cephalic. Okay, another way of doing the static neck exercises is I'm going to use in a different way, pull with the hand, but I prefer this way. Okay, this is when you pull with the hand, it's a little more difficult. You use the right hand to exercise the left side, and use the left hand to exercise the right side. The hand is training the contralateral side. Then as you see now, there's a pushing with the head forward, and you can check the muscles is working and all. You can use the diagonal muscles now. Yeah, now I'm going to do now the diagonal. Going to push in the right corner of your forehead, and you push. You're going to get now the focus on the diagonal muscles, the anterior right, and now we're going to the anterior left, diagonal now. The head will push diagonally. Then you're going to do the posterior part, the back side, diagonal as well. You're going to do the right side. Now you're going to do the left side diagonal. And at the same time, I push anteriorly, add cephalic, anterior cephalic on the occipital condyle, and one side just to give little traction. Now I'm going to show you how now this is occipital. Then you're going to see the occipital. Now we're going to see that C1 has no spinous process. When I say the occipital is like C0, C2 is the first bone that has spinous process, and now the C1 we'll be sure that we have enough space for C1. If we don't have enough space for C1, this will need to create a space, and you can use something called C1 release. And actually, C1 release is very simple. Okay, but when you put your head distal to the occipital, and now you're going to check, can you check yourself how do you have enough space between the occipital, which is C0, and C2? How are you going to check? Put your finger, feel the occipital first, then feel the C2, then put one finger between the occipital and C2. If there's enough space between the occipital and C2, it's called C0, Except we're going to call it C0. If there's enough space for one finger to go in between, that's a good sign. It means that's enough space for C1. If it's not enough for one finger, it means that this is jammed up. It means that the C0 or accept is jammed with the C2, and we need to create space between C2 and accept. We do some occipital release, or you do C1 release. C1 release, just put one finger there if you can. You can buy some stuff from Amazon. Just you lie down your back, put it there between the accept and C2. It's called, C1 release. If you need to buy the stuff, let me know. Write it down. I can make it available for you guys. And if you need supplies, let me know. But you can put one finger and between and lie down your back and just to breathe. Do that for 60 seconds. Going to help. Now I'm going to show the exercise with the towel. Using the same technique exercise with the towel. Okay, you're going to put the towel again and in the bar that, accept. I would like to do it distal to the occipital condyle. This is my technique, and I like it that way. Usually, it's shown that what you had in the occipital on the top part, but why using the distal, like distal to the occipital condyles? As I said before, I would like to increase the space between C0 and C2 to give more room for C1, prevent jamming of the main cable, which is spinal cord coming out from the brain through the foramen magnum. We need to create space. Is good. Now we're going to do the towel. I'm going to use the towel to push. You look at my hand now. I'm pushing forward and cephalic, forward and cephalic, forward and up. It give yourself a little traction, and it help with the creating space for C1, and this is good for headache as well. This technique could be helpful in case of headache, but we're gonna show more. For keep tuned, guys. Next video on the neck, we're gonna show you how to treat the headache, the cervicogenic headache. Now I'm gonna use a towel to strengthen the anterior neck muscles with the front muscles on the front of your neck. You're gonna use the towel. Gonna push backward with the towel and push with the head forward. This for sideways. Stay tuned. I'm gonna go show more exercises. Stay tuned. It's Dr. Salem Physical Therapy. Just Google Dr. Salem Physical Therapy and check what our clients say about our practice. Check or Google. Just Google Dr. Salem Physical Therapy. Stay tuned. I'm going to come up again, show you some more exercises, and I'm going to show a lot of beneficial feet. Bye now. See you soon. Stay tuned. If you don't subscribe, please subscribe. Please subscribe and like and share it with your friends so everybody can get the help. Write your comments, write your questions, any suggestions. I'm going to reply to all of them.